Hi everyone, my name is Michael Watkins and I'm here to give a presentation on two medications that help treat diabetes. According to the CDC, diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar, which is glucose, and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body cells for use as energy. When you have diabetes, and with diabetes, your body doesn't make enough insulin or can't use it as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much sugar stays in your bloodstream, and over time this can cause serious health problems such as heart disease, vision loss, and kidney disease. Some symptoms to look out for when it comes to diabetes is one, frequent urination, especially at night, urinating often, very thirsty, extremely thirsty, often losing weight without trying, very hungry, have blurry vision, numb or tingling hands or feet, feeling tired, very dry skin, and have sores that heal slowly, and also have more infections than usual. One of the first medications that is used, and this information is from drugs.com, is metformin. Metformin is an FDA-approved anti-diabetic agent that manages high blood sugar levels in type 2 diabetes patients. It reduces glucose absorption from the intestines, lowers liver glucose production, and improves insulin sensitivity. Metformin is recommended with dietary changes and exercise for better results, and it's used for managing blood sugar levels with medications such as metformin that can prevent complications such as nerve damage, cell damage, blindness, amputations, sexual dysfunction. Effective diabetes control will lower the risk of heart attacks or strokes as well. As you can see, the generic name for it is metformin, and then some brand names are Fortimet, Glucophage, Glucophage XR, Glumetza, and Riomet. It is a drug class is non-sulfonylurease. Non-sulfonylurease. That's the best to get on that. The other medication that is used, that's commonly used, is insulin Degludec. This information also is from drugs.com. Insulin Degludec is a long-acting basal human insulin analog that is used to improve glycemic control in people with diabetes. Again, insulin is a hormone produced by your body that helps you to lower your blood glucose or blood sugar levels for people with type 1 diabetes and some people with type 2, the type 2 diabetes as well. The generic name is insulin Degludec. The brand name is Tresiba, and the dosage is in a pen or a vial for subcutaneous injection, which means it comes in a pen or you use a syringe and you stick it into your arm or belly. The drug class is insulin. Metformin. How should you take metformin? You take metformin exactly as prescribed by your doctor, and you follow all directions on your prescription label and read all medication guides or instruction sheets. Your doctor may occasionally change your dose. Use the medicine exactly as it's directed, and take metformin with a meal unless your doctor tells you otherwise. Some forms of metformin are taken only once daily with the evening meal. And again, follow your doctor's instructions. And don't crush, chew, or break an extended release tablet. Just swallow it whole. And then what is insulin Degludec used for? Well, insulin Degludec, also known as Tresiba, is used to control high blood sugar in adults and children who are 1 year of age and older with diabetes mellitus. Insulin Degludec is not for people with diabetic ketoacidosis. Increased ketones in their blood or urine is not known and it is also not known if Degludec is safe and effective in children under 1 year of age. It is available in two concentrations, the U100 and U200. The 100 concentration is available in a pen and a vial. The pen can be injected from 1 to 80 units in a single injection in increments of 1 unit. Also, the 100 units vial should be used with the U100 insulin syringe only. The U200 concentration is only available in pen, and it can be injected from 2 to 160 units in a single injection in increments of 2 units. Some common side effects from metformin, and these are things to look out for. It says to get emergency medical help if you have signs of an allergic reaction to metformin, such as hives, difficult breathing, swelling of the face, lips, tongue, or throat. And it says some people using this medicine may develop lactic acidosis, which can be fatal. Get emergency medical help if you have even mild symptoms, such as unusual muscle pain, feeling cold, trouble breathing, feeling lightheaded or dizzy, stomach pain, vomiting, slow or irregular heart rate, and then also some serious side effects. These could lead to death, low blood sugar, dizziness or lightheadedness, blurred vision, anxiety, sweating, slurred speech, hunger, confusion, shakiness, headache, fast heartbeat, low potassium in your blood, and heart failure. Also, drugs.com states that your insulin dose may need to change if there is a change in level of physical activity or exercise, weight gain or loss, increased stress, illness, or change in diet. So again, or just something to know, if you start eating healthier and you start exercising more, your body will have an increased effect with metformin. Therefore, the metformin will lower your blood sugar even more, and you need to let your doctor know. That way, maybe he could possibly even lower your dose, or at some point, you might even be able to get off of metformin. Or the insulin Degludec, I should say. Again, some continued side effects, and these are just common side effects, are the serious allergic reactions, such as whole body reactions, reactions at the injection site where you put your medicine in, skin thickening or pits at the injection site, itching, rash, swelling of your hands and feet, and weight gain. And these are some common drug interactions with metformin. As you can see, there's a whole list of here. And actually, according to drugs.com, there's over 300 drug interactions, but these are the most common and most frequent ones that they see. But if you go to drugs.com, you can get a full list of all 300 plus interactions. It did say there was one food alcohol interaction, and that interaction is alcohol. Taking alcohol with metformin could reduce its potency. And then also some common interactions with insulin Degludec. As you can see, there is a long list of common interactions, some of them very similar to the ones with metformin. And again, at drugs.com, it mentions that there are over 300 possible interactions that can happen with the insulin Degludec, but these are the most common ones. And again, also the only food interaction it shows is with alcohol. Overall, both medications are used to treat both type 1 and type 2 diabetes. Through proper diet and regular exercise, a person has the potential to lower their dosage and even possibly stop taking these medications altogether. There isn't a cure for diabetes, and it is a lifelong journey and maintenance. It doesn't discriminate against age, gender, wealth, or social status. When not properly managed, it could lead to other health problems and premature death. I personally am a type 2 diabetic, and this is as a result of alcoholism, which I've now been clean and sober for over 10 years. But due to excessive alcoholism, I ended up with acute pancreatitis and became a diabetic as a result. And over the last 10 years, I have experienced, through diet and exercise, no symptoms to where I have fallen off the diabetic wagon, I guess could say, where exercise kind of took a backseat, as well as I started eating whatever I wanted to, and the diabetes came back. The symptoms came back to where I had to get put back on insulin and back on metformin. Once again, after that, with age, it makes it a little bit harder, but finding a better diet again and increasing exercise, regular exercise, even just walking around a block, 10 minutes a day, 3 times a week, can be beneficial. The resources I used are the CDC, which defined what diabetes is, and the drugs.com, which helped me find information for metformin and also for the insulin Degludec. I hope you have a wonderful day, and I appreciate your time.